Hello everyone, I'm Dr. Mona Sharma, Professor in Department of Periodontology, BBDCODS. Today we will be talking about gingival enlargement. What do you understand by the term gingival enlargement? What exactly is enlargement? When there is an increase in the size of gingiva is known as gingival enlargement. Initially, there were a lot of terminologies which were used along with gingival enlargement, like gingival hyperplasia or gingival hypertrophy. Nowadays, these terminologies are no more in use. What is commonly used is gingival overgrowth or gingival enlargement. Now, why don't we use these terminologies? The reason is that hyperplasia and hypertrophy, both these are terminologies associated with microscopic features. Hyperplasia means increase in the number of cells. The number of cells increases, so there is an increase in the size or a mass. Hypertrophy is increase in the size of cells. So because there is an increase in the size of cells, the mass also increases. Now, when we are clinically observing in the patient's mouth, we do not have microscopic vision. We cannot make out whether there is an increase in the size or increase in the number of cells because of which there is an enlargement. What we see is purely as is an increase in the gingiva. There is a growth in the gingiva. So instead of using hyperplasia or hypertrophy, the terminologies we commonly use nowadays is overgrowth or enlargement. There are various reasons for this enlargement, starting with the most common one is inflammatory. What do you mean by inflammatory enlargement? Inflammatory enlargement is that kind because of any inflammation. Inflammation, there is a hidden cause to it. What is that hidden cause? It could be trauma. It could be plaque and calculus, which is because of a buildup of plaque and calculus or an infection, an underlying infection. That is, I'm only talking about in the oral cavity, which leads to an increase in the size. Under acute, what we will see are the abscesses. It could be a periodontal abscess, it could be a pericoronal abscess, it could be a perioapical abscess. So because of these reasons, it is an acute in nature, right? It just suddenly flares up. So that is under the acute category. The chronic ones, as the name suggests, is chronic, which is slow, which is delayed. And this is primarily because of the accumulation of the plaque and calculus. Now, plaque and calculus, when it is accumulated over a period of time, it has adverse effects on the gingiva, on the soft tissue. Now, the soft tissues will react in an inflammatory way. There will be an increase in the inflammatory mediators. There will be an increase in the blood supply. There will be an increase in the cells which are present over there. So because of the surge of all these things, the size of the gingiva increases. Next, coming to the drug-induced gingival enlargement. I will be talking about each and every one of them in a little bit more detail. This is a basic classification that we're going to talk right now. Then there are certain drugs, for example, your anti-epileptic drugs, anti-hypertensive drugs, and calcium channel blockers, which lead to an increase in the size of gingiva. Then there are certain enlargements associated with systemic diseases or conditions. Diseases are separate and conditions are separate. As we all know, we cannot call pregnancy or puberty as a disease. These are conditions one undergoes, one faces. So that is why we have the classification has been delineated into conditions and diseases. Then due to certain systemic diseases, that is leukemia or granulomatous diseases, and neoplastic enlargement, that is, of course, as the name suggests, because of cancerous cells. It could be benign or it could be a malignant lesion. False enlargement. Lastly is the false enlargement. Now, depending upon the area, upon the distribution of enlargement, it could be either localized, generalized, localized limited to few teeth, generalized when it is more than 30%, marginal when it is confined only to the marginal gingiva, papillary only in the interdental papilla, diffuse when it is involving the marginal and attached gingiva. So discrete is when it is localized, when it is limited to a tooth, and diffuse is when it is involving the marginal gingiva, the attached gingiva, and sometimes also extends into the alveolar mucosa. That is diffuse because it is involved, it's diffused, it's spread out as the name suggests. Now, according to Bokenkamp et al., the degree of enlargement has been classified to make it simpler, because we have to render treatment. So we need to be a little bit more specific as to uh, what is the extent of the enlargement. So grade 0, no signs of enlargement. Grade 1, enlargement which is confined only to the interdental papilla. Grade 2, enlargement which involves papilla and the marginal gingiva. And grade 3 is enlargement which covers 3/4 or more of the crown. Now, coming to inflammatory enlargement. Now, what are the factors commonly that we encounter for chronic inflammatory enlargement? Is most common cause is poor oral hygiene. Poor oral hygiene, which leads to accumulation of any factors which lead to accumulation of plaque and calculus, both lead to a chronic inflammatory enlargement. So it could be poor oral hygiene, it could be malposed teeth, it could be orthodontic tooth movement, and the patient is unable to maintain good oral hygiene, improper restorations are done, the crown margins are inappropriate, which leads to plaque accumulation. So how does it begins as slight ballooning of the interdental papilla and marginal gingiva. Initially, it becomes as a life preserver shaped enlargement, which starts from that particular teeth. Then it spreads to adjacent teeth as well. Also, then it enlarges in that particular tooth till it goes on covering a major part of the crown of the tooth. Initially, it is painless. That is why it goes unnoticed by the patient for a very long time. Then as and when the enlargement increases, so it becomes a nidus for more plaque accumulation. When it becomes a nidus for more plaque accumulation, then it can be complicated by secondary inflammatory factors. So initially, which is a painless enlargement, because of secondary complications due to inflammation, it can get infected or traumatized, because when it is increasing in size, naturally when you're chewing, when you're speaking, the enlargement will cause hindrance. Because it will cause hindrance, it will lead to trauma from the teeth, from the adjacent soft tissues as well, and it can get traumatized. So this is a picture which shows when it slides in this area, there is a slight enlargement of the marginal gingiva as well as the interdental papilla, and you can appreciate this amount of plaque over here. So in this patient, definitely, of course, because it is in relation to an inflammatory condition, we can see the amount of plaque and calculus which is present at the gingival margin area. Histopathologically, we will see abundant inflammatory cells which are present over there. There will be an increase in the fluid, the inflammatory cells will be present. There will be degenerative changes, breakdown changes will be seen. There will be an increase in the fibroblast, because breakdown is occurring at the same time, repair is also going to take place. So there will be an increase in all these cells which are present in the connective tissue. Okay. Now, another kind of gingival enlargement that we see is associated with patients of mouth breathing. When there is mouth breathing associated, the gingiva of the maxillary anteriors, especially in the buccal area, that gets affected, and that area becomes reddish and it becomes enlarged. Gingivitis and gingival enlargement are very commonly seen in mouth breathers. And there you will always appreciate a linear gingival erythema, especially in the gingival margin areas of all mouth breathers. So it is very characteristic in a mouth breather patient. So the exact manner in which mouth breathing affects gingival changes has not been completely established or demonstrated. It is possibly because the oral cavity is constantly challenged with the environmental bacteria or any other irritational factors which are present in the environment. They cause inflammatory changes in the marginal gingival area. So as I mentioned earlier, if you can see in this area, and it will very characteristically end in the canine area, and it will not be present anywhere else. So mostly when there is mouth breathing, either of course the central incisors are going to be involved, the lateral incisors, sometimes even when the canines are involved. So that kind of reddish line will be present only up to the canine, and it will just disappear beyond the canines. So that can be appreciated. The affected gingiva is smooth, shiny erythematous with road margins. Here also, the affected areas sharply demarcated from the unaffected areas. Acute inflammation, as previously mentioned to you, that it is in condition of a gingival abscess, a periodontal or a pericoronal abscess. When it is a gingival abscess, it remains confined only to this portion, right? Only to this portion. And most commonly, the patients will give history of, maybe biting on a hard object or toothbrush laceration. The patients definitely give a history in relation to a gingival abscess, or when there is a forceful embedding of a foreign object into the soft tissues, like biting on a guava pit, or a grain, rice grain, and when it gets impregnated, or when the patient is digging the teeth along with a toothpick. That time also we see here gingival abscesses. And another very common example is while having egg, when a slight portion of the shell gets, we're unable to remove it from the cooked egg, and we accidentally eat that part. So that egg, the shell, it gets lodged, especially into the incisive papilla area. So that causes an inflammatory reaction, and it leads to formation of a gingival abscess. And in this, the lesion is confined only to the gingiva, the marginal gingiva, the interdental papilla only. Yes, because it is an inflammatory reaction, there will be a purulent focus, and there will be excess of neutrophils which are present in that area. Another one is the periodontal abscess. What is the periodontal abscess? Abscess is basically nothing but a purulent, it's a collection of pus in that particular area. So the cause of a periodontal abscess will be deep pocket, extension of inflammation from the periodontal pocket into the deeper supporting periodontal tissues, and a pocket which has a tortuous course. Tortuous means it has a twisted course. Twisted means it begins from one end, and it moves, and the base is at some other end. So when there is a pocket like this that occurs, there is no one pathway for the pus to be drained, for the purulent discharge to be drained out completely, because it is a tortuous, a curved, or a twisted course. So these areas are not communicating. They are definitely communicating, but because it is moving in different directions, one portion might get healed, the other portion might not heal in the same way. So if the healed part is coronal, and the unhealed part is in the apical area. The there will be no drainage of pus, so there will be a collection of pus in the apical part, and the coronal part, when that is healed, it will not let the pus drain out. So that is why there will be a collection of pus in the apical most area. Also, incomplete removal of calculus, the reason is the same. The apical part is unable to heal, the coronal part heals, there is no area for the pus to be drained out. And also after trauma to the tooth, any trauma, it could be biting on a hard object, or it could be uh, any external traumas also, which could lead to formation of periodontal abscesses. The abscess could be in the deep supporting structures, or it could be in the soft tissue wall of the periodontal pocket. Now the pain begins. The most common symptom of a periodontal abscess is pain, and there is an increase in the size of the gingiva. Again, the microscopic features remain the same. One additional thing over here will be the microorganisms that when we take a sample of the pus, we see that the microorganisms that colonize the periodontal abscess are primarily gram-negative anaerobic microorganisms. Coming to treatment aspect. Definitely, when it is a chronic inflammatory enlargement, the treatment that can be rendered is scaling and curettage. That goes without saying. For every enlargement case, when the patient walks in with increased size of the gingiva, the first thing that you have to do is do a thorough scaling and root planing. If there are any plaque retentive factors like a crown, or maybe an extraction socket which is present over there, or maybe a root stump which is present, or their mobile teeth, and the patient is unable to maintain those particular areas where there is excessive amount of plaque which gets retented. So those areas, those factors have to be taken care of. After a week's time, when the inflammatory component subsides down and the gingiva is still enlarged, then you have to go for surgical treatment, that is gingivectomy, that is excision of the enlarged gingiva. That is a separate topic altogether, and that we will cover in later lectures. When we're talking about the treatment of the periodontal abscess, our primary concern is relief of the pain, incision and drainage, and medication, and also to establish drainage. These are the factors we work upon when the aim is to treat a periodontal abscess. To treat a gingival abscess, usually the gingival abscesses heal on their own. But at the same time, if they do not heal, the causative factor has to be removed. The causative factor, once it is removed, the lesion heals on its own. I will not be going into much detail about the treatment aspect of a gingival and periodontal abscess and the gingivectomy procedures, because they are separate entities. Here they have been just mentioned, so one can understand that these conditions are treatable. They can be treated. So I'm going to skip this part, please, and we're going to So this brings us to an end of inflammatory enlargement. Inflammatory enlargement, as the name suggests, is because of the plaque and calculus. Now, there are other sort of enlargements as well, which are which are, the reason is the etiology is not plaque and calculus, but some other underlying etiology that we will cover in later lectures. Thank you for your patient listening and hope to see you soon. Thank you.